Hello, everybody. Welcome to another interview in our series here. My name is Chris Godden. I am owner of Balance Wellness, Acupuncture, and Herbal Medicine here in Austin, Texas. And most of our interviews lately have been with local Austin professionals, but I'm excited to have a non-local professional here joining us today, Amy Homer Brown. I am interviewing today. She's actually, we are in a mastermind group together, and she's got an awesome story and is doing some really great stuff in Portland. So I wanted to get her and be able to interview her today, and I'm very excited to do so, to learn more about you, Amy, and be able to share this information with more people, because that's what this is all about. So welcome. Yeah. Thank you for agreeing to do this.
Yeah, thanks for having me, Chris.
Yeah, my pleasure. So, Amy, we'll jump in. I think, you know, the best way with these interviews to jump in is just to find out how you got into this medicine, because you're an acupuncturist. I don't know if I mentioned that in the brief introduction, but for acupuncturists, you know, every now and then we see somebody where they're like, yeah, ever since I was a little kid, I wanted to be an acupuncturist, but that's usually not the case. We usually kind of stumble into it at some point. So what was your story? How did you get to this career path?
Well, I definitely stumbled into it.
Right.
So when I was young, I always wanted to be a doctor. And so, you know, that was the career path I had chosen initially. Amongst other things, I also wanted to be like an interior designer and a hairdresser and all these other things. But
yeah.
The doctor one always stuck. So my parents were in the alternative medicine world. They had their own clinic growing up.
Cool.
And I'm from Barbados. So it was not a very common thing there. Small islands, not super common. So I saw my parents, I would like go to work with them all the time, and I saw how much my parents would help people, just change their lives and their health. And it really inspired me to want to do something like that. But I knew that like alternative medicine is this huge, broad term, and I just didn't know what I wanted to do. So I was like, well, I'm gonna just go to med school. So I went to medical school, graduated, did a 12-month internship. And immediately after that, I applied for the naturopathic medicine degree at the National University of Natural Medicine in Portland. So I did the first term of that, got about 6 weeks in and hated it.
Oh, wow.
It really wasn't what I was looking for. I was really looking for something that was holistic in its mindset, in the approach with patients. And lately, like naturopathic medicine is amazing, but the program had changed that year and had become a little bit more allopathic than I had liked. So I switched over to Chinese medicine, just like kind of on a whim, because there were a lot of duals in my program and I'd heard a lot of great things. And so I was like, I'm just going to try it. So I did. And I loved it. It was pretty much everything I was looking for. And here we are 5 years later.
Yeah, that's amazing. So did something happen in that year-long internship where you were like, oh no, this is not for me? Or was it kind of a culmination of, you know, wanting to kind of fit more into the alternative medicine landscape that your parents were in? Or what made you decide I need to go further?
Yeah. Throughout my 5 years in medical school, I always had my mindset on something further, something beyond. And that's how I ended up looking into naturopathic medicine, thinking that was probably the direction I wanted to go. And I ended up doing the internship only because it's required so that I can get a license back home. And I hadn't, I didn't know long term what my future would look like and where I would end
Sure.
up, but I wanted to make sure that if I had to come back home, I could do that, and still like be a licensed doctor. So all that said and done, it really doesn't matter anymore.
Yeah.
Now I live here in Portland, but and I'm not a licensed MD since I never did residency. Um, and so yeah, that's just, that's how that ended up
Yeah.
being that way. Yeah.
Yeah. It's probably, I would imagine, helpful, or at least certainly gives you a unique perspective having gone through that experience. I mean, everybody who goes through Chinese medicine school, we have quite a bit of biomedical and kind of Western medicine in the curriculum,
Mm-hmm.
mainly so that we can talk intelligently with our patients and work with other physicians and kind of know what's going on with the body. But you
Yeah.
know, in the 4-year program, maybe a quarter of it is biomed, so that's a year.
Yeah.
Whereas you know, you did 5 years of kind of allopathic and really getting quite a bit deeper than anybody who's gone through just the masters in Chinese medicine would have
Yeah.
done. So has that been helpful for you when treating patients to kind of be able to have both of those views?
Yeah, definitely. I'm able to fully understand procedures since, I mean, I know there's always the medical lingo and being able to communicate with others in Western medicine terms. And that's probably, I didn't do the biomedical stuff in school, obviously. I got credit for that.
Yeah,
So
nice.
I don't know exactly what was taught, but I'm like, I guess that it would be just learning the lingo, learning the language, learning the diseases, getting familiar so that you can translate those terms, Eastern, Western. Um, but what you don't get a lot of exposure to is like how medical procedures are done and lab tests and um, how things are typically treated in the Western medical realm. And so I have some familiarity with that, especially in the hospital setting, since that's where most of my medical education is. Um, so that has been really helpful with a lot of my interactions with patients, um, especially the ones who are like, I have been to see a bunch of specialists and I've had done this test and this test and this test. And I'm like, okay, yeah. And I know what all of that means.
Yeah.
And it seems to put them more at ease, that I can understand a little bit better what that means for them and what their experiences were like.
Yeah.
Yeah. So
Yeah. And
I
that's
think
just,
I can relate differently.
yeah, for sure. And that's just so common for most folks when they're coming to see an acupuncturist. It tends to be, at least in the US, after they've tried a lot of different things. You know,
Yeah.
unfortunately at this point, acupuncture isn't thought of as like, oh, I'm starting to have issues with my health. Let me go see an acupuncturist to see what they can do for me. We could do a whole lot for them at that
Mm-hmm.
point. I mean, this medicine, its sweet spot is honestly with prevention and helping people when they're first starting to show signs and symptoms. But it's
Yeah.
usually folks who have I mean, in a lot of cases, exhausted what they can do through the Western medical model, and then we get them,
Mm-hmm.
and they're like, "What can you do for me? Help!"
Yeah, pretty much.
Just, you know, we can take care of them too, for sure. That we've just got a lot of different tools in our tool belt, which is great. And
Yeah.
you specifically practice a style of acupuncture which I had a little bit of exposure to in school. I had classmates and colleagues who went a lot deeper, like you did, but
Mhm.
I myself didn't really go that much deeper than what I was exposed to just through the master's program, which is this Japanese style of acupuncture.
Mhm.
Will you explain what that is, how it's different from, I guess, Chinese style acupuncture, and how you know how you use it differently?
Yeah. So Japanese style acupuncture is like the theories and philosophies are still based on all the same Chinese medicine principles. But I think where the difference is in the way the techniques are used, the hands-on techniques. So it's a lot more gentle in a lot of ways. And we use something called the Takehome or a non-insertive needle, which sounds modern in a way because you don't see acupuncturists use it generally unless they're Japanese style. So it's like, oh, well, this must be just like a new thing that they came up with, except it wasn't.
Right.
The Takehome is actually one of the original 9 needles that we learn about in Chinese medicine school. And so it's just as old as the medicine, but I think somewhere along the way it just kind of disappeared on the Chinese side, and the Japanese seemed to pick it up and went crazy with it. So,
Yeah.
it's a lot of what they use. That's for a lot of Japanese style acupuncturists, it's their primary needle style. Like they don't even use insertive needles. Um, and then those that do, they use like the really, really small, thin gauge needles that are like just shallowly inserted, like not deep, not heavy stimulation usually. Um, and so that's how it's got the view of it being a more gentle style of acupuncture, especially great for those who are a lot more energetically sensitive.
Yeah.
Yeah.
Yeah. And I've found that, and just to be super clear for folks listening, non-insertive needle is exactly what it sounds like. It is a needle that you are not actually inserting into any of the body tissue. So it's a little bit, I think the ones that I've seen, it's thicker, right? It's quite a bit thicker than a normal needle would be, because it doesn't have to have like a super fine point to it, because it's not
Mhm.
penetrating any tissue, right? But
Yeah.
you use that on specific points, to stimulate the points, but it's extremely gentle because you're not going into the tissue at all. So you're using that a lot. And then if you are doing an insertive techniques, you're using the same sterilized one-time use needles that Chinese acupuncturists, or most acupuncturists in America are practicing some sort of Chinese style.
Yeah.
But it's the thinnest needles that we use, and really not going for aggressive stimulation. And I mean, I was amazed taking the classes and seeing the response that we could get from folks with that little stimulation, but it seems like it's a very precise form of the medicine. Like you have to get your points down just right in order to have those big shifts. Is that what you found?
Yeah, I mean, it's very palpation based, like um, a specific point that, is defined as this location is not necessarily that location in Japanese style. It could be just like 2 millimeters away. Like it could just be so subtle a change and a difference in the spot that you're in that that's what makes the real difference. And it's like it's so touch based that if it's so subtle, like definitely a big thing with the Japanese style is developing that sense of touch,
Yeah.
um, just to be able to pick up those subtleties.
Yeah.
Yeah.
And have you noticed that there's a specific, I mean, you already mentioned like people who are more energetically sensitive tend to do
Mhm.
better with Japanese style. Are there any other just kind of general groups of people that seem better suited for Japanese style, than otherwise? I mean, maybe they have specific symptoms or whatever.
Um, the first one that comes to mind is children.
Okay. Yeah.
Yeah. So a lot of pediatric acupuncturists are familiar with Japanese styles because of the non-insertive work. Like children are seeing as having so much energy, within them. And so it's not even that we need to do a whole lot for them. It's just a matter of regulating what they already have. And so it's very, very common for children, for sure.
Yeah, excellent. Do you find that it's also good for like anxiety, like people who are just really, really anxious and kind of sensitive in that way? Like emotionally sensitive, not necessarily. I mean, some people may or may not know if they're energetically sensitive, but
True.
emotionally sensitive, even physically sensitive. I guess sensitive just across the board. Do you find that that's a better style for them too?
Yeah. Yeah. Agree.
Yeah. Yeah.
That. It's definitely been really effective for folks with anxiety and helping to calm the nervous system. Or even if you like don't have a sense of anxiety, like there's just like there's just some sort of stress within the nervous system, that agitation, it helps to calm that as well, I find.
Yeah.
Yeah.
I would imagine that's really helpful because I know you work with some motor vehicle accident patients, and I would imagine that that's really helpful for that because I mean there's physical trauma in those instances, but the nervous system just gets so jacked and it's just like blah, blah, like kind of buzzing at that level. So being able to calm that down with the Japanese techniques has to be just incredible.
Yeah.
And I know you do some body work too, like
I do.
with the okay. So tell me about the body work that you do.
Do a lot.
Where to begin?
I know. Most of what I do is myofascially based though. So I have a very high interest in fascia that I developed in Chinese medicine school. And anatomy. Like I didn't actually like anatomy back in medical school, so it's like a whole different me now.
Oh yeah, I love it. I geek out about it. So yeah, I'm right with you.
yeah, seriously. But I think my first dive into it was with like a Swedish massage course I had done, and I don't do that now, but it was my first dive in. And then I went into doing some shiatsu. So like even now I still incorporate a lot of shiatsu into my treatments. And then there's myofascial release itself. Do a lot of that. I do a lot of cranial sacral, and sotai. So sotai is a Japanese style of bodywork, which is basically a form of neuromuscular reeducation. So basically reconnecting mind and body to basically reconnect with itself.
Wow.
So yeah, and it's basically a lot of really subtle movements in the joints. And I like to do the sequence from like foot all the way up to your shoulders. And it's really interesting. It's one of my favorite things because people are so disconnected with their bodies that they're like not making some of the movements and they think they are, or they're like, I don't know, how do I do that? And so it really, really connects them in that way. But the most important part of it is that it works with your breath. And so breath work is the neurological part, I'd say, just because it really, since the breath work is so like inhale and then slow exhale as you make your movements, like it really activates the vagus nerve, I think. And so sotai can be so relaxing in that sense. Again, calming down the nervous system while making those connections in the brain and in the body again. It's kind of magical.
I mean, I could just see how that could be so effective, because you really are retraining the nervous system to, you know, do all of these different movements while it's in a really relaxed state, so
Yeah.
that when you're going about your day and, you know, obviously doing some form of these movements when you're walking or driving or whatever, and
Yeah.
it can kind of go back to that memory of, ooh, last time I did this, I was in a really relaxed state. So let's hold on to that. That the nervous system is so good at holding on to those memories, good and bad memories, you know.
Yes.
If
Yes.
you're super stressed all the time, your nervous system kind of goes back to that state. But if you can train it to be more relaxed, then
Yep.
I could totally see how that would be super effective. Makes me think I need some of that. I need to try it out.
Yeah, I mean, so much healing happens at rest. Like,
Yeah,
that's where your body heals. It doesn't heal. It's not thinking about healing if you're like in your fight or flight response, because you're like,
it's survival, right?
yeah,
Yeah, it's
you're like,
survival in that state.
I'm not in the state to heal myself. I'm in the state to just like survive life,
Yeah,
whatever's happening, everything
right.
around me.
Yeah.
Yeah.
So if you can get it back into that rested state, that parasympathetic nervous system activation,
Yep.
then you can actually get things to happen. Like digestion's going to be better, immune system's going to be better, all the good
Yeah.
things.
Yeah.
That's awesome. So in you're doing the movements passively, or you're having them do those movements
They're
while they're lying
active
on the table?
movements.
They're active movements. Okay.
Yeah. So the patient is consciously doing all of these things, but like the movements are really subtle. And so um, I think that's part of the relaxation component, because, and I'm sure you come across a lot of this, but some people have a really hard time relaxing.
Yep.
And so like everything they do is really like strength based. And so it's like, it's okay. You can use a little bit less strength. And then I like take it down a notch every time. A little less strength this time, a little bit less this time. And it's really interesting how you see people fall into their bodies when they do that and are able to find a little bit more relaxation each time.
Right. Well, it's such a, I mean, it's an American cultural thing where we're just always thinking more is better. You know, if I can
I
punch something
know.
hard, then punching it harder would be even better, right? If I can do something strong, even more strength is going to be better. And that's
Yeah.
completely counter to Chinese medicine philosophy, where
Yeah.
more is not always better.
Better.
It's all
Yeah.
it's all about the balance. You need to have that balance of forces, or you're going to get sick. That's
Yeah.
I mean, if you boil down Chinese medicine to its purest form, that's pretty much it. It's when things get out of balance, you're sick. When they come back into balance, you're well.
Yep. Yep.
So yeah, I could see that
Definitely true.
being an issue for some folks.
Yeah.
So, I mean, Chinese medicine practitioners do so many things, and we've already talked about. I don't know how many different techniques that you do, but I'm sure there's more. What else do you do with folks? What else does a typical treatment look like with you?
I mean, a typical treatment is basically like the treatment part itself is going to be a mixture of both the non-insertive and insertive,
Okay.
or just all non-insertive, just, depending on patient preference or what I'm feeling in the body. But yeah, it's a mixture of needling and it's a mixture of body work. Like I will always do my best to incorporate body work where I can. Um, I think, yeah.
That sounds super relaxing. I mean, I'm sure you get great results. Do you also give like are there take home steps for folks where they have to do anything to keep the momentum, or are you of the mind that we'll get all of the work in on the table and go off and do whatever you're going to do, and then come back and we'll continue our work on the table, or what's your philosophy on that?
No, I definitely think that a lot of the work that happens is outside of the treatment room. And so while I do a lot in the treatment room, like I would love for it to stick around in the body. So,
Right.
you know, like there's just depending on what the issue is, like say it's a pain patient and they have, say shoulder pain or wrist pain or something. And like you could go home and you can do sotai on yourself. Like I can teach you to do that. You can go home and you can do moxa on yourself.
Right.
I guess that's another thing I didn't mention. I do a lot of moxa.
That's a very important part of the Japanese style, right? It's moxa.
Yeah. I can't believe I forgot it.
Yeah.
But yeah, I do like the rice green style, the really tiny cones with like the highest grade of moxa. And it's one of my favorite things too. Everything's my favorite thing.
In combination, it's just so effective. I agree with you.
Yeah. I forgot what I was talking about initially before I talked about moxa. What was I
think we were talking about a typical treatment.
Takehome.
And Takehome.
Yeah,
right.
Yeah. So there are things that you can do at home as well. And I do a little bit of herbal medicine. I don't do a lot of it, but I'm making my way into learning more and being more familiar with that. So I do a little bit of herbal medicine. I don't think everything should happen in the treatment room. I feel like a lot, because it's like that's 1 hour that you spend with me. And then there's the rest of your life that you do every day, 24 hours, 7 days a week, you know?
Right.
So
you can undo a lot of that, huh?
Yeah. And I think it's really important for people to be invested in their own health. And so, and that's not just, you know, with money or anything. It's definitely with how much time you're putting into taking care of yourself at home and what you're doing for that. So like, even if it's drinking less caffeine, because you're having tremors and palpitations, you know, like maybe that might help. Probably don't drink 5 cups of coffee a day.
Right.
So, you know, just even small lifestyle tweaks here and there that might be helpful. You know.
Yeah. And I think, you know, we're in such a unique position because of the education that we've gotten, where we're able to see these connections, where a lot of folks, particularly the folks who are, like you were saying, are so disconnected from their body, you know, we're going to see something where it's just like plainly obvious to us. But, you know, as somebody who's living it day to day, it's really easy to just miss, like, oh yeah, maybe I should stop drinking all that coffee if I'm having trouble sleeping. Like it's really easy, and a lot of people miss that simple stuff. And that I think is a huge area where we are able to provide a lot of help. You know, just being that outside observer with a lot of knowledge of how these systems work together can be really just all somebody needs in some cases. And mix in the acupuncture and bodywork, I mean, they're going to be feeling great.
Yeah.
So what are there, like the style that you practice, is that pretty common in the Portland area? I'm in Austin, and I know that Japanese style is probably not all that common, but in Portland, what you do and mix with the bodywork, are you pretty unique, or are there a lot of practitioners doing it?
I'd say what I do is pretty unique. There are not a lot of Japanese style acupuncturists in Portland. Like Portland has acupuncturists everywhere. You could throw a rock and you'll hit a acupuncturist store.
Oh yeah, okay.
They're everywhere. Acupuncturists and NDs alike, but a lot of them are not Japanese style trained. And so I don't think we're very common, which is interesting and unique and great.
Yeah.
Yeah,
Yeah,
because
that's
I'm sure
good.
there
It's
are
that,
others that
yeah.
incorporate bodywork maybe, but um, the style of acupuncture is definitely going to be unique.
Yeah. Yeah.
Yeah.
And that's great because I mean, even for people who have, potentially tried acupuncture in the past for whatever issue, if they're thinking
Mhm.
about trying it again, this really is a different type of acupuncture. Um,
Mhm.
and I mean, we're like you said, we're working with the same theory, but it's quite different.
Yeah.
So it can be really effective for folks, like you said, particularly those ones who are very sensitive or perhaps just have their nervous system just so hyper active that
Mhm.
they need something that's going to settle it down without providing more stimulation.
Yeah.
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 Okay. Um, so let's see. I also wanted to ask you. Oh yeah. If are there questions that you get from your clients? Is there like one question that you get most often from your clients where you wish you could just be like, everybody, here's the answer to this one question, so I only have to answer one, or has that not really happened to you where are you getting a lot of different questions at this point?
Um, I feel like I've been getting a lot of different questions.
Yeah, just a lot of curious people, huh?
Yeah. I can't think of a single question
Mm-hmm.
per se. Um, I see so many different people with like chronic issues, very different chronic issues. So
Mm,
um, they all ask different questions. It's usually questions about like the theory of what I'm doing. Like, what's your um, what's your thought process about what you're doing?
yeah.
Or why are you always at my belly?
Yeah.
Or like little things that I do along the way. Um, yeah.
Yeah. Yeah, because it is really um, a lot of people are really curious about the techniques that we use because again they're just so different from what they've been exposed to, and it's
Mhm.
because when this medicine was developed however many thousand years ago, we didn't have blood tests or MRIs or all of these other diagnostic tests that we do now. So it was, like you said, palpation based and observation based, but you
Mhm.
can learn so much from a person just by feeling what's going on and inquiring like, oh, you have this symptom at this
Yeah.
time of day and you're also having this symptom, oh, those are probably connected. Like that,
Yeah.
it's an art that I'm so happy is not lost. It's definitely still around and thriving in the Chinese medicine tradition for sure.
Yeah. Yeah. I love that you said art because I consider it like that too. It's
Yeah.
totally an art. Like you get it better and better with practice, like art.
Mm-hmm.
But um there's so many connections and they're so unique and individual from person to person, and you can always be surprised.
Right. Yeah.
Yeah.
And I mean, and just that, I mean, that aspect shouldn't surprise me, even though it does, that people are different and that, you know, that their bodies are going to react differently from their neighbors. Like, of course, right? If you sit down and think about it. But yeah, it is amazing, just the different needs of different people and how different somebody can go through, or two people can go through the exact same stressors or exact same traumatic events, but because of genetic predispositions or
Mhm.
childhood trauma or not trauma, they can have completely different reactions
Yeah.
to that stressful event. And treating those people with what they're coming in with feels like what medicine should be to me, you know?
Yeah. Like I'm not someone who can just come up with a plan for a treatment before I see a patient. I actually had someone ask me that once recently.
Yeah.
Like, oh, do
Yeah.
you know what you're going to do every time I come in? Do you have like a plan? I was like, no. I
No.
just wait till I see you and then I just do what your body tells me to do.
Yeah.
Like,
Makes it easy
I'm
on
here to
us,
listen
right?
to your body, that's what I'm here for.
Yeah.
So,
Yeah.
yeah.
It's fantastic. I mean, there's such a big need for this type of medicine. There's a huge need for conventional medicine too. I'm not saying that that's not needed. I mean, we absolutely need that.
Absolutely. Yeah.
Oftentimes in life-saving situations, I joke to my clients, like if you are in a car accident, don't come to me first. Or if you have a heart attack, go to the hospital first. They will save your life. But
Yeah.
then after they save your life, then you can come to me and we'll figure out, what else happened there,
Yeah.
so that we can get you back to feeling your best.
Yeah. Definitely. There's a place for both in the world. And um, I was talking to someone about this the other day, but like, there's no need for a divide. It's not natural medicine and not so natural medicine. Like, it's not like that. And I don't think it should be.
Yeah.
And maybe it's because I've been trained in both, but I feel like they have the potential to work really well together. And you can see it in China. Like, acupuncturists are all over in all like the Chinese hospitals in China.
Yeah.
They work
Yeah.
together. And that's proof that they can work together if people could open their minds a little more and be like, I'll work with you
Yeah.
to figure things out together. And definitely allopathic Western medicine has its strong points, and it's
Yeah.
definitely an emergency care. Like, that's one of the biggest things: surgery, emergency care, things that um, that like natural medicine could help with. Yeah, but like, I don't think there's a real guarantee for
Yeah.
anything. I mean, there's no guarantee either way, but there's this thing that this medicine is strong in. There's this thing that this medicine is strong in. And so natural medicine has always been so great with prevention
Yeah.
and recovery, and allopathic medicine is so good with emergencies and not all that great with prevention. It's
Mm-hmm.
And I can speak to it. I didn't learn a lot about um, the details of what prevention looks like. You
Yeah.
learn, eat well, don't eat too much salt, don't eat too much
Yeah.
sugar, avoid the hypertension, avoid the
Right.
diabetes, like, eat well, exercise, blah, blah, blah. But like, you don't learn the details of what any of those things look like.
Yeah.
I don't,
Yeah.
I had one course in nutrition
Yeah.
in medical school, and it was basic nutrition. Like, what am I supposed to
Yeah.
do with that?
And it's simply because there's so much else to learn. Like one profession,
Yeah.
it's naive to think that an MD can learn all of the stuff that I know or that at this point. It's just too much.
Yeah.
So that's why I think there's always going to be a place for both professions.
Professions, yeah.
So because it's
One
impossible,
person
I think,
can't
for
do it
one
all.
person to know it all. Yeah, exactly.
Yeah.
I can't do it all.
I can't remember everything from everything, like, I've studied with both, and that's a lot of information I keep in my brain. But like, you can't know everything. There's no way you can know everything.
Yeah. Yeah.
It's not how we're built.
Right. So we'll just keep working together.
Yeah. Yeah.
Well, I want to thank you for taking the time to do this interview today. Before we wrap up, would you give us contact information, how to get in touch with you, company information, and I know you're splitting your time between 2 locations, so if you could let us know like when you're at each and hours and everything.
Yeah. So as you just said, I'm at 2 locations. I'm Both are in Portland. So one is in Southeast Portland. That's Ikigai Wellness. And the other is in Northeast Portland at Be Well Acupuncture. I'm at Ikigai Wellness on Tuesdays and Saturdays. Website for that is ikigaiwellnesspdx.com. I'm going to guess Chris will put that down somewhere. And then I'm at Be Well Acupuncture on Wednesdays and Saturdays. Website for that is dessabingley.com. And so that's where you'll be able to find more information about what I do and me as a person, and get booked for a treatment with me.
Yes, excellent. Yeah. Well, I highly recommend anybody who's in the Portland area, and if you've been curious about acupuncture, or particularly if you have anxiety or sleep issues, or like we said, anything that is more chronic, after issues have come up and they've been around for a long time, or you're trying to prevent issues from occurring, that's really the sweet spot of this medicine. And Amy will take really great care of you. I'm sure of it, just because you are very well trained in a lot of these wonderful techniques. So thank you again for sharing all of this awesome information with us. I appreciate it.
Yeah, thanks for having me, Chris. This was really fun.
All right, sure thing. I'll talk to you later.
All righty.